We still are not like up to our normal patient load for the day, and so things just don't look normal, like what we expect them to look like or what they did look like before. And so we just are trying to take it day by day. I mean, things are picking up, but I don't think it's ever going to be the same. I think people are scared to come to the doctor's office. I think they're scared to go to the hospital, and I think that's really sad because people are not getting help when they need to get help. My name is Megan Stanfill, and I am the owner of Agape Family Health, and we are a primary care clinic in Columbia, Tennessee, and we do primary care for the whole family. So we give shots, we do well childs, we do GYN visits for women, we do just wellness visits in general, and then we do all sick visits. We have been open for 3 years in April of this year. So we opened in 2017. We were actually at a different location, and then we're now at our current building, which is downtown Columbia, and we love that. I would say being in Columbia is really neat just for the fact, one, it's our hometown. We get to see the people that we live with, and we get to be here. But Columbia is really just kind of a neat place to be, and the fact that we are downtown, and so we get to see all the growth downtown that's happening, and we get to see random people just walking by every day. We have our normal people that we see, and so we can kind of see out our window and we're like, oh, there they are today. Like, so we watch for our normal people to walk by. And so it's just really neat because it's a small community, and we know each other, and we know our patients, and they know who we are, and we see them in the grocery store, and we see them at Walmart, and it's just neat to be able to have that hometown feel in Columbia. So things were really kind of confusing and difficult in the beginning of COVID. We really didn't know what to do. We didn't know what to expect. We didn't know if we should leave our door open, if we should stop seeing people altogether, was our staff safe. We didn't have the PPE that we needed to care for patients with that, just because it's not something we see on a regular basis, and we don't have to do that whole get up normally for our patients. And so it was really difficult to just kind of figure it out day by day. But we just tried to take the advice that was given to us from the health department, the CDC, other local businesses, and just kind of roll with it. So we never really knew, are we doing things the right way? We just tried to do what we could do to protect ourselves, first of all, but then to protect our patients. So we ended up locking our door, and we had people call, and we would triage them over the phone just to see if they had potential coronavirus symptoms. And then if they did, we would actually gown up. I went to Lowe's and bought like painter suits that was recommended, and then we had masks, and we had a face shield, and we had goggles, and we would put all that on, and then we would go outside to the car and see the patient. So we were able to protect everybody inside the building and not to bring it in here into the building. But if the patient we thought didn't have those symptoms, then we would bring them in. We just tried to keep everybody out of the lobby, tried to keep people away from each other, and just try to take it day by day. And then as things slowly progressed and we learned more, we were able to figure out how we needed to clean and how we needed to sanitize in between patients, and what gear we needed to wear and what we didn't need to wear. And then slowly, when things kind of opened with the state, we were able to say, okay, I think it's time we can unlock our door. And so now our door is unlocked, and we're still functioning a little bit different than normal. We try to keep all of our well patients in the morning as much as possible, and then see sick people in the afternoon, just because we still don't really know who has it and who doesn't. So it makes it really hard because you can't have that personal one-on-one connection really anymore. There's a barrier in between you and your patient. One, your equipment that's protecting you, but two, the car. Like it's hard to really get close and personal with someone who is in their car, and we're not really set up to see people outside of our rooms that we have set up to see people. And so it just kind of created obstacles, and we just tried to do the best that we could for our patients, but also keep everyone else safe. But it definitely was not that personal connection that we like to have with our patients. So I think people just need to know that, we have to get back to a normal point in life, and we have to get back to community and get back to just being able to be more normal like we were, and that, it's summertime and we can get back to being outside and being in the sunshine and doing those outdoor activities and just bringing life back to people. I think that's one of the biggest things that happened in quarantine, is that our community got lost, and so we need to be able to have that community again. Go outside, have picnics with people, meet your friends at the park, meet people there. You definitely have to be cautious in doing that. The numbers have gone up a little bit since we've had some larger gatherings going on. And so just being able to be smart in what you're doing, but also be around people. We were made for connection, and so we have to have that.